My name is Ali Atkinson. I work for Virginia Consumer Voices. I'm a lifelong resident of Virginia, and Senator Watkins is my senator. VCV works with several organizations around the state that have been heavily involved in signing individuals up for health care. Open enrollment ended yesterday, and we're really pleased with how many Virginians have signed up for affordable health care under the ACA. One of our partners in Northern Virginia finds that about 1 out of every 4 individuals that come to them seeking health care falls into the coverage gap. These individuals work in low-paying jobs that do not often offer health insurance. Their household income is too low to afford private insurance, and they are unable to qualify for Medicaid under current rules. A few months ago, at Celebrate Healthcare's event there in Woolfest in Hampton Roads, I met Brenda Harrell, a former hairstylist. She came to the Enroll-Fest hoping to find coverage. She's been out of work for about a year, has heart and respiratory failure, and has been denied health insurance. She has not seen a doctor for over a year. Ms. Harrell, oxygen tape in hand, sat down with a certified application counselor, but learned that her income of less than $10,000 is too much to qualify for Medicaid in Virginia and too little for a subsidy to help her buy a plan in the marketplace. Eventually, it is likely that Ms. Harrell will end up in an emergency room. She will be sicker than she should have gotten, her bill will be higher than preventative treatment should have been, and our health insurance premiums will go to cover her hair. We are paying for an inefficient patchwork treatment. Our safety net is broken. Today, Virginia has foregone $450 million to close the coverage gap. Let's shift our funding to proactive, smart care and help our economy, our community, and fellow Virginians. I'm asking you and your colleagues in the House to support the governor's budget, bring our tax dollars to Virginia, and to provide high-quality, affordable care to all by closing the coverage gap. Thank you.
Thank you very much. Aaron Stegler, looks like Robin Graham, followed by Doug Britt.
Good afternoon, Chairman, members of the committee. In the interest of time, I'm going to hand off my testimony. It's actually the testimony of someone who is affiliated with the SEIU, and she was unable to make it today, so I want to give my time to those who were able to travel.
Thank you very much. Robin, Graham. I have a little trouble pronouncing, it doesn't have a little trouble reading.
Not a problem. Good afternoon, Mr. Chairman, members of the committees. Again, I'm Robin Gann, and I'm here representing the Richmond. I am a resident of Richmond and a constituent of Senator McEachin, and I represent the Virginia Interfaith Center for Public Policy. I want to thank you for this opportunity to talk about the importance of closing the coverage gap in Virginia. The faith community is deeply connected to people in need of health care. They are involved in faith-based hospital systems, clinics, and other charitable health services. People of faith help low-income families when they are struggling with unforeseen illnesses or when illnesses have devastated their already limited financial resources. People of faith believe that life is precious and sacred and that individuals are called to care for one another. Healthcare access is a moral imperative. To deny access to the least among us is to ignore our moral obligation. And so I ask you to please continue the important work you've done to close the coverage gap without delay.
Thank you very much. Gray?
Mr. Chairman, members of the committee, I'm Doug Gray. I represent the Virginia Association of Health Plans. I wanted to let you know I get my insurance coverage through my employer. I think every conversation with somebody about this issue ought to start with where they get their coverage from, because it really shapes how you think of the issue. My members have been in the business of providing managed care services to the Commonwealth for almost 20 years. I've got a map passed out that has the locations of the 7 members who provide this coverage. We do have an emphasis on limiting waste, fraud, and abuse and providing high-quality services. We serve women and children predominantly today, but are now moving into foster care and dual eligibles as well with the work of the MERC. Our MCOs are ready to work with the legislators and administration to implement and enroll Virginians in commercial line products, whether it's the proposal in the governor's budget or whether it's the proposal in the former Senate budget. So we are ready to go, and we're already thinking through the process of how to do what needs to be done. By providing coverage through a fully integrated managed care arrangement, the state gets that budget certainty. You get to budget the exact amount you're going to pay, and you can be certain that the services will be provided in a high-quality fashion. We are taking the risk. That is a private sector approach. financial security. And look, that's really what insurance is about. You're not going to go bankrupt if you've got insurance. And that's the most important part of this. And that leads to their family and the opportunities of their family. One illness can wipe out a family and their children's opportunity. And then the last I'd say is if the General Assembly determines that the program to close the coverage gap is not affordable, if the match changes, we can just won't it. It's not something that's impossible. It's been done before. We had a testimony from Tennessee about TennCare in which they did exactly that. So it is not something that is beyond the possibilities. Thank you for the opportunity to speak with you.
Thank you, sir. Audrey Dutton, followed by George Long, followed by Ray Davenport, followed by John Bruce.
Good afternoon. Thank you for the opportunity to address you. I'm here today to say, I'm sorry, forgive me. I'm Audrey Hill. I'm here today to address you, to ask you not to do Medicaid expansion without a thorough review and audit to improve efficiency. There have been stories documented that the outcomes are not what they're credited to be. And it sounds like a wonderful idea. Oh, let's just take the money back that we have contributed, but it does not always work that way. That is really what I would like to talk about, but I heard somebody say something about fairness earlier, and I would say health is important, but when it comes to fairness, I need a car. Why shouldn't I get a car? Why shouldn't everybody who wants one not get a car? That is one way of looking at it. The efficiencies need to be addressed. It's very easy to say, let's take the money. But we do need to separate the budget, approve a budget so schools can work, police officers can get paid, and look separately at this matter of Medicaid expansion and what is really involved. What is the real problem? How do we get rid of the waste fraud